Today, you will hear not only a personal story of healing from sexual abuse and childhood trauma, but references to research regarding the intersection of sexual abuse and breastfeeding, and coping mechanisms that have been helpful for our guest and that could prove to be helpful for you too, sexual abuse or not. If this is a topic you should avoid for your own well-being, please do so and come back to it at a time when you feel ready. When I began breastfeeding, I was blindsided by how difficult it was. I may have thought I was prepared, but having known only a handful of people who had ever breastfed and only seeing it up close from a couple of them, I had a huge learning curve. Since then, I've become a doula, a lactation consultant, and a childbirth educator. I'm your host, Lo Nigrosh, and I welcome you to the Milk Making Minutes, where we explore breastfeeding experiences through the lens of systemic barriers, so that you know your breastfeeding struggles are not your fault, and your triumphs really are the miracles you feel they are. Welcome to the Milk Making Minutes. Today I have a guest who is remaining anonymous, but is bringing to us a very important topic related to sexuality and sexual abuse as it relates to breastfeeding. So welcome. I'm so happy that you're joining us today.
Thank you so much, Lo. I'm very excited to speak about this topic, and I want to thank you again for holding space for this very important topic that isn't talked about enough
in my professional life. People come to me and ask about how breastfeeding will impact them if they have encountered any sort of sexual trauma, or even in the birth world, we hear a lot about birth trauma as it relates to breastfeeding. You hear people talk about feeling touched out and how that relates to and our own sexuality. And it's really great to be taking a moment to focus on that here at the Milk Making Minute. So I'm really glad that you had this idea and that you're willing to share your personal experiences and also all the thinking you've been doing around this.
Thank you. And, that's where I was thinking of starting, is more just about kind of sexuality in general. The topic can be somewhat taboo even nowadays. And one of the things that I personally experienced, and I know many other moms as well, is just the topic of sexuality and how it was approached in the family of origin, right? So we may have been raised in a family that had a lot of shame around sexuality or even around body parts. And it can be as simple as just using appropriate names. So one of the first examples I just want to give from my personal experience is that at home, we spoke a different language. And so certain body parts, it took me well into my adulthood to actually recognize that I did not know their actual names in that language. I knew kind of the cutesy names, that you were raised with, but I didn't know their actual names in that language. I knew them in English because of school, etc. But at home, we never used those names. So it took me, into my 20s to recognize that I don't even know what the word is for nipples properly. And, just that realization was like, oh, wow, why was that never talked about? Why was there shame around it? Why was there the stigma around it? And then, that can go further into, as toddlers, there's some self-exploration that happens. There's some touching, right? And again, in our family of origin, how was the response to that or the reaction to that? Was there shame? Were you embarrassed or ridiculed? How did you feel around that? Did you feel safe approaching your caregivers and talking about things or, exploring that? And that is something that happens often for various reasons, cultural reasons, religious reasons, etc. And that also can have an effect on our breastfeeding relationship, as I'll talk about in a minute. But then also sexuality, right? Was it thought of as being bad or dirty or a sin, right? And then how does that affect not just breastfeeding, but then the rest of our relationships going forward, the rest of our, romantic relationships in the future? How do we feel about ourselves when we do have sexual desires or urges? How in tune are we with those? How comfortable do we feel with those? So I just wanted to address kind of this topic first because I think this is much, much widely experienced, obviously more than the sexual abuse. I think this aspect of the shaming of sexuality and our body parts and our bodies is really a widespread epidemic. So I'm not sure if you're comfortable, Lo, but I was curious if you've experienced any of this yourself personally.
Yeah, I definitely have. And it took me, long into adulthood to be comfortable with my body. Still
Mhm.
a work in progress, really. I think breastfeeding really brought some healing to that because I had to be okay with my body and I had to display my body in a way I never had before, but I had to do it for my child. And it brought this fire in me that my body is just my body and I'm using it to bring sustenance to my baby. And I am going to stand up for my baby. And I never felt the need to do that before that because, we should be able to do that just for ourselves. But becoming a parent and needing to do that for my child brought this additional fire to me that really helped me be able to be like, no, I have breasts and I have nipples. And no, I'm not going to flaunt my nipples around. But if somebody sees my nipple, it is a nipple and it is used to feed my baby. And whether you are a teenage nephew or my
Mhm.
cousin or my cousin's kids or just a stranger out in public, if my baby needs to eat, my baby needs to eat. And I became quite strong in my conviction that I was going to feed my baby or my toddler. Yeah, so it's been, I think breastfeeding was first step for me to say my body has a purpose. And even if the purpose is a sexual one, which in this instance I'm talking about it's not, it's okay. But breastfeeding was like the first step for me to be able to kind of embrace that, I think.
Beautiful. And I love that fire that you talk about because that's something that I resonate with as well. Because when it comes to our children, especially, like you mentioned, it gives us this purpose beyond anything that we felt before. And we have, like you mentioned, this conviction that I am going to feed my baby, and breasts are made for breastfeeding. Yes, there may be other sexual things associated with them as well, but breasts are made for breastfeeding. And that's something that I know many moms struggle with is, maybe showing more skin than they're used to, showing breasts, showing nipple. And again, kind of the stigma that maybe our families have had around that, and it also, turns up in the fact of how do our family members respond to it when we do breastfeed, right? Many of my family members to this day even act in disgust or embarrassment for me when I breastfeed my child, even at home. And especially if out in public, I get comments about, why do you have to do that here? Don't let anyone see. And for certain moms, depending on where they are emotionally, and again, what trauma they've experienced in the past, that can have very different responses and reactions. And for myself, that fire that you mentioned definitely came up in me when my daughter was born and when I started breastfeeding. And I just kind of said, hell no, I'm going to do what feels best to me. I'm going to follow my intuition. And I just want to acknowledge that not everyone has that gut, that visceral reaction, and that's okay because we've all dealt with such different things. So, but if you do feel that coming up and you're afraid of expressing it, I do want to encourage you to go ahead and follow your intuition and follow that gut and visceral response and know that it is okay and that breasts are made for breastfeeding. And the key is that anyone who's trying to sexualize it, that's on them. That's not on you.
Yeah, I think the other thing to point out is that people's role in their family of origin might be different than my role in my family of origin. So I was
Mm,
already in my 30s by the time I had my children. I lived far away from my family of origin, so I saw them pretty infrequently. And I did get a lot, I did get a fair amount of pushback. I grew up in a very religious family who are very conservative politically and body wise. We did not discuss bodies. Even things like farts were ignored.
Mhm. Yeah.
We, I did not know names to body parts. You brought that up.
Mhm.
Even in English, I did not know names of body parts.
Mhm. Yeah.
And, so I had a lot of learning to do as an adult, and I'm rechanging that narrative for my own children. And when I started breastfeeding, if I was visiting home with my children, a blanket would be brought to me as I was
Mhm.
breastfeeding, and I would say, I don't need that. And I would be told, well, your nephews are here. And I would say, my nephews can see what breasts are for, and that will help them down the line, you know.
Mhm.
But I had a different role in my family than I know many people that I counsel have. Some people rely on their family more financially and feel like they need to kind of walk a line, or some people are more involved with their families or more dependent on their families. They're more tied to their families emotionally than maybe I was. And so I recognized that it was a little easier for me to let that fire out because I had moved far away from my family and was less tied to them both emotionally and financially than some families are.
That's a great point to bring up, absolutely. And, then we can kind of start transitioning to a little bit of trauma because there's various kinds of trauma that can happen in the family setting or outside of the family setting that can actually affect those roles and relationships that you were mentioning. So when we look at not even sexual trauma, but just trauma in general, there's two main groups. There is something called childhood abuse or developmental trauma, which tends to be ongoing trauma that happens during the early years. So most significant is before the age of 7, but all the way up to even the teenage years and before age 18. And then there is adult trauma that can happen in a similar fashion where sometimes it can be ongoing. However, then there's also these acute traumas, which are one off instances. And so, depending on the kind of trauma that you may have experienced, there's different ways of looking at it. So something that was a one-off acute trauma, which can be even something like a car accident, it can be something like a sexual assault, it can be a rape or anything like that. That tends to process a little differently in the brain versus something that was childhood related and developmental trauma related, because these things were an ongoing experience. They were not one off, and they literally shape our perceptions of ourselves. And I'm going to kind of talk about these concurrently, but especially when it comes to sexual abuse, childhood sexual abuse, we're going to kind of acknowledge differently than if you did have a sexual assault or a rape when you were an adult. Those can be looked at differently and treated differently. And essentially, the common thread is that with whatever kind of trauma you did experience, there are overwhelming emotions and feelings that happen during that experience that our body can't handle. And research shows that there are times when the memories of the trauma can be completely repressed or forgotten, even for decades. And then they can emerge as images, sounds, or thoughts related to that particular experience. And sometimes you may not even have an image or a thought or anything like that. You may just have these feelings come up. So I've done a little bit of research on this topic, and there are moms who have shared their experiences where they don't remember anything necessarily, but as soon as they're trying to get their newborn baby to latch, they experience intense shame, disgust, anger, fear, even rage. They need to vomit, they get nauseous, they get physically sick. And some of these are aware that they did have a traumatic experience of sexual abuse, and some are not. And again, I just want to bring a little light to this because sometimes moms may be experiencing these feelings and emotions and may not recognize why or may not understand what they're feeling. And now this is not to say that you definitely have had an experience. This is to say that this is where you want to get professional help if you do feel like this is resonating with you, or if there are aspects of this that you're curious about. And I'm going to give some more resources later on, but one resource that I highly recommend is the Postpartum Support International Group, postpartum.net. It has counselors and therapists who are trained specifically in the postpartum period. So, especially if breastfeeding after maybe a traumatic birth, anything like that, these are professionals who are there to specifically help you.
I just want to differentiate between what you are describing and DMER, which is dysphoric milk ejection reflex. So DMER is it happens right around the time of the milk release.
Mhm.
It's pretty rare, although people, you do hear a fair number of people experiencing DMER, which is sometimes there is an abrupt drop in dopamine at the time that the milk is released, which for some people can trigger feelings of intense anxiety, feelings of sadness, feelings of hopelessness right around the time that the milk gets ejected. But then it usually clears within a couple of minutes. And so that is a hormonal response to the milk ejection reflex. I just wanted to make it clear that if you're experiencing some of these feelings of sadness and hopelessness, you can bet that it's happening right around the time that your milk ejects, whether or not you feel your milk ejection, right before your baby is really ingesting that milk. So, whether you feel that letdown or not, it could be that it is DMER. And so, if you're like, oh man, I don't know if I've ever been sexually abused, and I'm feeling these feelings of hopelessness and it's always around the same time, it could be that it's something like DMER. That's why it's good to work through these things with either somebody from Postpartum Support International, as you mentioned, a lactation consultant, somebody who really understands the different components of what might be happening.
Yes, thank you for making that differentiation because, like you mentioned, that's a hormonal temporary versus a reaction to a
Mhm.
triggering response.
Exactly.
Yeah,
Right.
no, I
But
love that.
some of the
Yeah,
same feelings can
right.
occur, that hopelessness, that sadness, the anxiety can happen, but it's not in response to an outside trigger, it's in response to a hormonal drop.
Yes. And like you said, exactly, working with someone who's familiar with it. So, lactation consultants and then someone who specializes in postpartum
Mhm.
is a wonderful way to explore it and to help because there are coping strategies even for that as well that can be helpful to help make it through that period, those couple minutes.
Our guest went on to describe how, in her search to understand her own triggers better, she began to learn more about how the brain reacts to environmental triggers and a fight, flight, fawn, or flop response. And if latching the baby to our breast is one of those triggers, our emotional brain can be constantly sending out danger signals, which can feel really unsafe in those moments. This is what she had to say about her own experiences being triggered while nursing her own baby.
So, if we are latching our baby to our breast and we have certain images or thoughts or sounds that come up and that trigger us, our rational brain is not able to differentiate that that was then and this is now a safe time. So the underlying brain, the emotional brain keeps working. The stress hormones keep secreting. We are in this state of fight or flight. And personally, this is something that I have experienced with my daughter. And for myself, it varied. So there were moments when we actually first started breastfeeding, I didn't get as many of those reactions. However, with certain people in my life continuing to make sexual comments about breastfeeding,
Mm,
about I'll share some of them. Why not? There were some people who mentioned comments like, "Oh, you just want to keep her at your breast because you like it. You like the sensation of people playing with your nipples. You like the sensation of
mm,
her licking your nipples." And that is absolutely not the case when we are breastfeeding. We are breastfeeding our baby for the purpose of feeding our baby. But when
mm,
people around you make those kind of comments, it can trigger you, and it triggered
mm,
me. So when those comments were happening, I would get this inner rage, this inner fight or flee response. And there were moments that I wanted to literally rip my daughter off of my breast and throw her. Yeah, and I did not throw her, but I would not so gently place her on the bed or the couch next to me.
Mhm.
And that was my triggering response. Now, I know many of you may have different responses, but that was one of my triggers. And what's interesting is that when it was just my daughter breastfeeding, I did not have that reaction. But with responses from others, with sexualization of breastfeeding from others, that is when that would get triggered in me. And
Mm.
so that is when my emotional brain would kick on. My rational brain would turn off, my emotional brain would kick on, and I would start reliving the trauma. And that is essentially what happens when we do have these triggering reactions to certain things. And ultimately, that stemmed from various sexual abuse and sexual assault that I've experienced through the lifetime. Some was in childhood, some as an adult. And when those comments re-triggered that in me, I physically was not able to have my daughter at my breast. I physically experienced a rage and an anger. And thankfully, I have had supportive mentors who have taught me coping skills. And with these coping skills, I've been able to momentarily have that triggering experience and then come back to the present moment, reconnect with my daughter now, because when she was little, I wasn't able to reconnect with her, and continue our breastfeeding relationship. So, this is also a time for me to express hope for you that if you are experiencing some of this, that it doesn't mean that you can't have a successful breastfeeding relationship because there are coping skills that can absolutely help. And there are various kinds of sexual abuse that you may have experienced. There may have been inappropriate or unwanted kissing, touching, fondling. There may have been molestation. There may have been rape. There may have been sadistic acts. It can have been even non physical acts. So sometimes children are forced to touch themselves or to watch others touch themselves or look at explicit images or videos. So there are different levels of the sexual abuse that may have taken place, and therefore there are different strategies and coping skills that you can learn. And this is also, I want to chime in and say that if you feel like this is something that you just can't go forward with, I respect that. And I absolutely hear you. And it's a personal choice that you can make. And I'm going to go into a little bit of the research as well, but also some support and strategies that even as providers, because I know there's many providers that listen to your podcast, Lo, and these providers can also use this information to help support moms who have been through this as well.
Thank you so much for sharing, first of all, those personal experiences. I think it can be so triggering for people when someone else is sexualizing their experience with their baby, especially if they were forced to have sexual experiences as a young child, because that's the last thing that they would want to do for their child. And so then it adds trauma upon trauma. So I just want to take a moment and pause and like just say how hard that is for so many parents. And you then feel voiceless again because sometimes it feels for those people that there's nothing they can say in that moment to that person to get them to understand because they don't understand the breastfeeding relationship. Yeah, and I also just want to acknowledge what you said about, different people need to make different choices for their family. So for you, the best choice was to figure out those coping strategies and to continue the breastfeeding relationship for years. And for other people, the best thing for their family, given their situation, might be to find another path for feeding their baby. And I breastfed through severe pain for years. And some people did not understand that. And they thought, why would you keep putting yourself through that? But for me, that truly was the best pathway for me. That's what I knew what was best for me physically and emotionally. But I always tell people, I know that is not the choice that everyone needs to make. And so each person has to evaluate their situation and decide what is the best pathway forward for both my mental health and my physical health, and looking at my complete situation and deciding what is my next right step in this very moment.
Yes, beautiful. Absolutely.
Do you love to read about pregnancy, childbirth, and breastfeeding? Are you looking for books to help you become a more confident parent? Or perhaps books to help you understand what went wrong with your breastfeeding journey or to do better next time with breastfeeding? Or do your kids have questions about breastfeeding or pregnancy, but you don't really know how to answer them? Would you prefer to have a curated list on these topics? Go to the link in the show notes to my new affiliated bookshop. Every purchase you make benefits the Milk Making Minutes. But better than that, these books are vetted. I've read them all, and I feel very confident recommending them to you. I'll be adding to them continuously, so go to that link when you want to purchase a book. It will help the show, and you can feel confident it will be a purchase you will enjoy.
And that's the thing, we're all so different. All our experiences are so different. So definitely following your heart and intuition. And it actually, what you mentioned was interesting earlier on as well about how breastfeeding was so healing to you. I'm not sure if you know, but there was actually research done on this. In 2012, there was a study that was published that showed that sexual assault survivors who then continued to exclusively breastfeed were actually lower risk on sleep and depression parameters
Oh, wow.
than those who were sexual assault survivors who went to formula or mixed feeding. So I thought that was such an interesting thing that you brought up, and that the study actually showed that it was, for some of us, it can be such a deeply healing experience to reconnect with our bodies again and to almost find purpose and to be able to nourish our babies with our body. There is something so deeply healing about that.
Mm-hmm. Mm-hmm.
So I love that you mentioned that, because this was a study that I definitely wanted to talk about today. And I have to say for myself as well, the breastfeeding experience has been deeply healing, even more so than just the breastfeeding portion of things, but the skin to skin contact, being able to nurture.
Mm-hmm.
When that side of me came out, I could feel healing happening, because many of us who did experience trauma were not nurtured in the ways that we would have wanted to be as children. And by standing in our power and now nurturing our children the way that we wanted to be nurtured, again, that can be deeply healing in itself, because it's never too late to reparent ourselves as well, and to give ourselves the experience in a way by giving it to our children. Does that make sense?
Oh, absolutely. Yeah, to this day, sometimes at night when my kids still need me in the middle of the night and I'm sleeping in a tiny twin bed, I think,
Mhm.
man, I'm so tired. I wish I could just send them off to bed and kiss them like they do in the sitcoms. And then
Mhm.
I think, is that really what I want? Because years from now, I want them to know that if they need to call me in the middle of the night, even as adults, I'll be there. And this is how I do that,
Absolutely. Yeah.
is by knowing that when they call me in the middle of the night, here I am.
Hmm. That's beautiful. Yeah. And there was actually one other study that in 2017 was done, so fairly recent. And it was interesting that what they noticed is that, so women who did experience childhood abuse did have more complications with breastfeeding. So they specifically measured mastitis and pain, and that they did notice that breastfeeding was a trigger for memories at times of the childhood abuse,
Mm,
and that up to 58% of their sample reported disassociation when breastfeeding.
mm,
I did want to mention this because for those who aren't familiar with disassociation, what it is literally a feeling that you are not in your body,
mhm,
where your mind separates from what's happening to your body, And this is a trauma response. This was the way that you coped, or we coped with it when we were little, because again, of the overwhelming feelings and emotions. So by literally separating our mind from our body, it was a protective mechanism so that we were able to tolerate what was happening to us.
Some common dissociative behaviors include scrolling on your phone every time you nurse or when you are having a hard time with your kids, fits of anger or rage, or even a feeling of watching yourself from the outside. Modern day parenting can feel so isolating, even without trauma. So many of us turn to some of these behaviors, even without specific trauma induced triggers. But if you feel as if your dissociative behaviors are your only coping mechanism, it could be time to reach out for some support. There's no better time than the present.
And so, again, this was important for me to mention because if you do start noticing this happening, this disassociation where when you're breastfeeding, you feel like you are not present, like your mind goes somewhere else. Again, this is one of those times that professional help may be very helpful. And so I just wanted to put that out there. Again, Postpartum Support International is a great resource. And there's actually an international resource as well called the Marseille Society.
Mm.
So if there are any international listeners, there are international resources available as well.
Yeah, well, Postpartum Support International is an international resource, but I have not heard of the Marseille
Mhm.
Society.
Yes, they have. I can't remember all the countries right now, but they have multiple areas as well.
Oh, that's great.
And then I did want to end on a positive note on this little portion is that there are several studies that show that even women who have been sexually abused, they're just as likely to initiate breastfeeding as anyone else.
Mhm.
So I want you to know that you are just as likely to initiate breastfeeding and be successful as breastfeeding as anyone else. It depends on the resources and support that you have available and what you feel ready for. Because, like we discussed earlier, some of you may decide that this is not the best option for you, and there are other ways of feeding which may be better for you and your family. And if you do feel like breastfeeding may be the best option for you and something that you want to do, I want to empower you to go ahead and try it. Get the support and resources that you do need. And is it okay if I share a couple strategies that may be helpful if moms are wanting to kind of move forward and see if they can try some of the coping strategies?
Absolutely. Yeah.
Yeah. So the first thing is the thing that made the biggest difference in my experience was having a trusted, safe person that I could talk with. And that's where, again, that Postpartum Support International is huge because that's where I found my therapist, who was also a mom. She specializes in the postpartum period. She's worked with many other moms. So having that non judgmental place where I could share and get things off of my chest was absolutely huge. And then there is a certain kind of therapy that if you have experienced these traumas, whether they be sexual or not in nature, I highly, highly recommend something called EMDR, which is eye movement desensitization and reprocessing therapy. What I mentioned earlier is that our traumas, they're not full stories. They don't come out in a beginning, a middle, and an end. We see an image or we hear a sound and we get a flashback to this triggering experience. So what happens is this is almost never ending. There's no end to it, right? Until it gets integrated, until we start processing it, until our brain integrates it, then those flashbacks, those triggers are going to keep coming up with the same intensity. And this EMDR therapy is shown to be effective for trauma integration. And again, there's therapists that specialize in this, and you may need to shop around between those as well, and that's okay. And this is one of the things that personally has made a huge difference in my life as well. I had the regular therapist who we did a lot of talk, a lot of CBT and mindfulness, which is something I'll go into in a moment, but also this EMDR piece was very specialized and very helpful in helping move past some of the traumas. And it's a resource that not many know of. So I wanted to put that out there as well.
So far, my guest has emphasized the importance of finding a therapist that specializes in the postpartum period and in a specialized therapy that helped her called EMDR. Before we move on to another tool called mindfulness that has helped her tremendously and which many of us have heard of recently, I would like to add that so many of my clients have sought out therapists who did not fully understand the impact of breastfeeding on mental health and who were dismissive of the pain of a failed or changed breastfeeding relationship. If your care providers, including mental health care providers, do not understand the pain you feel about a lost or changed experience, this might be a sign that it is time to find someone who does understand your pain. And it is okay to seek out new care providers, either providers providing care to your baby, to you for your own physical health, or care providers that you have sought out to improve your mental health.
Now, when we're triggered, like we mentioned, we want to numb out. It's difficult to be present during those triggering moments. However, something that we can train and practice doing is being present in the actual moment during safe experiences. So, even right now, right here in this moment, we can do a quick mindfulness practice that can take 30 seconds to a minute that can start getting you in tune with your body and start recognizing that right now, right here in this present moment, we are safe. All is well. And this practice, once I started doing it, was transformational because then we can start applying it during those triggering moments with the help of a professional. So, right now, is it okay if I guide us through really quickly, love?
Of course.
Yeah. So, right now, in this present moment, we're going to tap into our senses. So, I want you to open your eyes and just recognize 5 things around you. What are 5 things that you can see? And they may be totally, regular objects like the phone that you may be holding, or the laptop that's in front of me, or the cup of water that I have next to me, or maybe you are holding your baby, or whatever it may be. What are 5 things that you can visually see right now? So the next thing is 4 things that you can feel. Take your hands. What are you sitting on? Is it an office chair? Is it the couch? Is it the bed? Is it soft? Is it hard? How about something that you're wearing? Is it fuzzy? Is it smooth? The next thing is, what are 3 things that you can hear? So if you become really present in the moment, maybe there is a TV playing in the background, or maybe there's a fan going, or maybe you can hear traffic outside your window, or maybe you have kids running in the background and screaming. Just become fully present to 3 things that you can hear. Now, the next thing is 2 things that you can smell. And so maybe you can smell your baby as you're holding them, or maybe you can smell food cooking. And then the last one is 1 thing that you can taste. So just being fully present in your mouth. What is something that you can taste? Maybe it was breakfast from this morning, or a drink you just had, or the taste of your toothpaste. And now, this quick exercise, I went into depth a little bit with it, but you can do at any moment to become fully present and grounded. And I encourage you to try this throughout the day, just during regular, safe experiences. It not only helps you become present and really enjoy where you are and what's going on, it trains your body to feel safe. And that is one of the cornerstones to then being able to work through some of these triggering experiences and working with someone going forwards. Some other really quick strategies that I can share are like getting your body moving, starting to feel alive again, whether it is doing some dancing around to some music, even yoga, stretching, getting up and walking around. When we move our body, we start to become present in our body. And as this presence increases, our safety, our feelings of safety and well-being increase. Because right now, here in this moment, all is well and we are okay. And that's really what's catapulted my healing. And I hope that some of these strategies and resources can help you as well. And I did want to add in that on my healing journey, I've had a different way of expressing myself that is completely not my go to, but I started writing poetry about some of my experiences. And I wanted to share it. There's a Facebook page, and it is just glimpses of poetry as I've been going through my healing journey that I think many of you may resonate with, and some of the mindfulness coaching that I do to help support this healing is on there as well. There was one other thing I did want to quickly mention for providers, right? So those of us who are working with this population and who, you yourself mentioned that there's been moms who have asked you about this. These are just some of the things from the research that I've seen and picked up. And one of the things that, especially as lactation counselors or consultants, sometimes certain providers want to be very touchy-feely. And sometimes with this particular group, you want to limit touching.
That is good practice for everybody. There is very rarely a moment when a lactation provider needs to touch somebody. That used to
Mhm.
be kind of standard practice even 9 years ago when I had my baby. And now, like, really, you don't need to be touching anybody. Very rarely do you need to be touching anybody because
Yeah,
that person needs to build self efficacy to feed their baby. And if you are the one latching their baby, they're not building that self efficacy.
definitely. Yes. So important because it is. We want to give power to the moms. They're going to be the ones doing this for sure. The other thing is that sometimes in this area, moms may not be able to latch baby because of the sensations. Sometimes they may be able to pump.
Mhm.
So that is an option to explore. And sometimes that is even too much. So sometimes adding in coping skills during pumping can be a combination that may be helpful. But ultimately, some moms may not be ready for this step. They may
Mhm.
not be ready to talk about it.
Mhm.
And at the end of the day, I just encourage providers to remember that it is ultimately the mom's choice and that our job as providers is really to mirror what our clients and patients are sharing with us and to
Mhm.
really hold a safe space for them. And so sometimes the breastfeeding relationship may not be successful. And just remembering that that is no reflection on us, it is that mom making the choice that's best for her and her family.
Yes, and I think our job is to help that mom bond with that baby regardless of her feeding choice because bonding might be difficult to begin with. I also wanted to add when somebody reaches out to us and they're wanting support, one of the biggest indicators of whether or not breastfeeding will be successful is how much support a person feels. And so, one of the biggest things we can do as a provider is get that person connected. If we ask them, how supportive is your family? How supportive is your partner? And they're kind of on the fence, or even if they're like, oh, yeah, my spouse is really supportive, my partner is supportive, my family is supportive, that's still not the same as having a group of other people feeding their babies. One of the biggest things we can do for new feeding moms is get them connected to other people feeding their babies from their bodies. And in person, if it's in person, even better. I know that's hard in a post COVID age. We're still in COVID a little bit, but it's possible. It exists. So let's really work hard prenatally and during that early postpartum period and beyond. If you know a mom is feeding a toddler, get her connected to other moms feeding toddlers. If you know a mom is planning to breastfeed and she is pregnant, get her connected to breastfeeding support groups where she can see other moms feeding their babies, because that is a huge indicator of breastfeeding success, how connected she feels to a community of people. Because in the end, it's probably not going to be the lactation consultant that she really confides in with all of her questions. I mean, that person can be a great support, but it really is going to be the moms she meets out in the community. And if she does not have other moms that she can ask questions to, it's going to be a tougher go for her.
100%. That's so important. Absolutely. Community support. We are social creatures, and that's so crucial for our not just breastfeeding success, but our experience in motherhood as well.
Yes. Well, thank you so much for sharing your personal experiences, the research. We'll make sure to link all of the research that you provide so that if people like to dig into the research themselves, they'll be able to do so. And then also the support resources that you shared, and then the Facebook page that you will be making available to people. That's all going to be so helpful to people and critical to addressing this topic.
Awesome. Thank you so much for having me, Lo. And again, thank you so much for this safe space to share.
Of course.
This week may have felt a bit different than most. We talked not only about personal experiences, but also about how you can bring healing to your own life in order to continue breastfeeding if you feel triggered by past traumas while breastfeeding. Shining a light on topics such as these takes away the shame and empowers us to do better. All of the resources and research articles my guest referenced are linked in the show notes. We continue conversations like these in the growing Milk Making Minutes community group on Facebook. Come request to join the group. We need your voice to continue having conversations like these and chip away at structural barriers that make breastfeeding so difficult for so many of us. See you there.